So I'm gonna hit record. Okay, so we're doing muscles. This is the last chapter that we're covering. We'll cover this across 2 lectures. So I'm gonna try our share screen again. Hopefully this thing's working. I'm gonna click on here. Click, yeah. Okay, yay, we're back in business. I don't know what happened. My computer just got possessed, but like the IT pro I am, I just restart and there we go. If it's beyond that, then it's out of my wheelhouse. Okay, so muscular system, there's 3 main parts. The part 1 terminology is not that huge of a part. We're really going to focus for this chapter. You're going to have to name muscles, really know where they are in the body, whether it's a diagram and I'm pointing to stuff, and you should know every muscle that's listed and what it does. If we do the essay format exam, it will be more a list of descriptions where I might give you a sequence of movements that you're going to have to name the muscle and its action as you describe the sequence, or there's just questions about muscles in certain locations, what its action is, or just basic. If it's just a normal practical, there's basic pictures that say point to this and name the muscle and tell me what it does. So that's really the variations in the formats that you'd be presented with this material. So as far as muscle terminology goes, we have types of muscles in how the fibers are arranged. So there are these 4 kind of ways that they're arranged. Parallel and fusiform are known as our strap muscles. And the sartorius muscle is the one that we're going to talk about later that goes diagonally across our thigh. It goes from our anterior superior iliac spine across the front of our thigh to the medial top part of our tibia. So we'll get to that in the next lecture actually, but it's really long and flat and pretty even in width. And so that's known as a parallel muscle. Whereas the other one, the fusiform, biceps brachii is a good example. It's got a thicker middle part. It's sort of how you classically draw a muscle. So you'll see these terms, parallel versus fusiform. Let's move forward. A convergent muscle, this one is an pectoralis major. It goes across the chest, so it has a wide base of attachment. In this particular case, it would be attached to the sternum, but it fans, so it's got a wide base, and so, but it's converging down to a smaller single point attachment. So it looks like a fan. It's called convergent. And then pennate. Pennate muscles could be like this one's multi-pennate, the deltoid, because we would have 3 sections, anterior, middle, and posterior. But the main thing with the pennate muscle, and to move the videos over to the side, is that notice instead of like a strap muscle where we have a tendon and then the fibers go and then another tendon, where the muscle is just in the middle. A pennate, the tendon actually goes all through the muscle and the fibers just radiate off to the side. It's arranged a lot like a feather. So the main stem, I don't even know what you call it on a feather, that would be the tendon, and you have smaller sections of muscle radiate off from there. So that's a pennate. These are less important for the purpose of our class, but something that you need to have, just be aware of and know about, whether you go into a biomechanics course, the way these muscles are arranged make a big difference on how they pull and the type of strength and action that they have. So there are some implications with regard to more biomechanics, less so about what we really want to do. So this is more just being aware and knowing the basic terminology. We can see different pennate muscles in this. Circular muscle, easiest one, it goes in a circle. They're pretty much what we call our sphincter muscles. So we have one around our eye. That would be orbicularis oculi. We'll talk about that later. We have one around our mouth. We've got sphincter muscles around our anus. We have them around our gallbladder. We have them around lots of different places. So circular muscles are just that. They go in a circle. The other level of terminology you should know for muscles is muscles always start from an origin. It's usually more of the fixed point and then the insertion. It's really going to the part that's moving. So if we're talking about, say, your biceps brachii is the one that most people are more familiar with, although it does cross 2 joints, most of its function is to raise up your forearm. And so that would be the insertion point would be on the forearm, where the origin is somewhere on the humerus itself, as well as one of the branches being up onto the scapula. So just know the terminology for origin insertion. Now, if you were taking an anatomy class that's just an anatomy class, not this anatomy physiology combo thing we've got going on here, but then the traditional way of learning muscles is for every muscle, you need to know the origin, and that would be the skeletal system feature, one of the many that we went through in the skeletal system, as well as the insertion. So you'd have to know those, as well as innervation and blood vessels. So for us, because it's a combination, we drop off some of the information, is I don't require you to know the origin insertion. However, sometimes we'll talk about them because knowing, and you may find it useful in your studying, not to memorize for a test, but to understand what the muscle does. Why does a muscle, sometimes we have some muscles that might be sitting right next to each other, but because one is going to insert, say, on the front of a joint where the other one inserts on the back, they actually have opposite actions. So sometimes looking at the origin insertion helps you understand their action, but just know that you don't need to you identify the origin insertion for these exams. Now, agonist, antagonist, and synergist, these are terms that you definitely do want to know for the exam. So when we talk about a muscle that does an action, so if I was talking about the biceps brachii and it's lifting your forearm up, so if I go on the screen and it's, contracting your arm here, and we're talking about the biceps brachii, that main movement means it's the agonist for the movement. But in this same movement like this, the antagonist, the one that does the opposite, that would cause my arm to go out, that would be an antagonist. So in this example, and we haven't done the names of the muscles, but I'm trying to use one most people are familiar, but there's the biceps brachii and the anterior humerus. We have the triceps on the posterior humerus. And so that would be, so if we were to say flexing at the elbow, move this way, flex at the elbow, the agonist for that movement is biceps brachii, where the antagonist is the triceps, the one on the back of the arm. But if we were to change the movement, what if I were to say extending the arm out, making the arm go straight? In that motion, the agonist would be the triceps, because that's its job, is to pull it out. And the antagonist would be the biceps brachii. So the point I'm trying to make is not to confuse you with muscle terms, since we haven't done the names of the muscles yet, but is to let you know that for a movement, there is the main muscle that does the movement, and then there's the muscle that would do the opposite. And a given muscle sometimes is an agonist for a movement, sometimes it's an antagonist for a different movement. So there's not just a list of agonists and a list of antagonists. It depends on what the movement is. Now there's a synergist, which usually tends to be smaller muscles. A synergist is a helper muscle. So maybe we are doing something like if our hands and our arms are straight up above us, and we're doing that, we're diving into the water and we're pulling our arms straight down. This movement of our arms down, for example, would utilize our latissimus dorsi. It's a big muscle in our back. We'll talk about this a little bit later. But we have lots of other muscles on our back. The main ones, usually the biggest one for that movement, would be the agonist. But all of the other smaller muscles that help in bringing your arms down, they would be called synergists. So they're all doing, agonists and synergists are all doing the same motion. They're just sort of helpers. They're just smaller. So this is some terminology. We'll bring these into play as we start talking about the specific muscles and their movements. Naming of muscles, this slide here, you don't have to memorize. I'm not going to say, tell me the muscle name for size. Well, some tests have that. I don't think the one you have is. This is just telling you examples. Look at the names. They're sometimes going to tell you exactly where they are. So rectus femoris, the word rectus means straight. In fact, people think rectus. What do you mean? I'm thinking rectum. And in fact, the word rectum, although we're not in 202, but when you do 202, the rectum is actually the last part of the large intestine, and it's called rectum because it's the last straightaway, actually, right before it turns into the sigmoid colon. So the direction of fibers, in this case for muscle, rectus means it's straight. Sometimes it's about number of origins. Biceps, it has 2 origins on that, so that one sort of named that. But it's also biceps femoris. That one tells you where it's at. It's the location. We have biceps brachii, that's in our arm. Biceps femoris is actually going to be on the back of our leg. It's one of our hamstrings. It's also named for action. I think last time Brian mentioned something about adductors. So adductor magnus, we have 3 adductor muscles. One's adductor magnus, and so it's telling you its action, but it's also telling you its size, magnus. Just like gluteus tells you it's on your butt, maximus, it's the big one. We have 3 gluteal muscles, maximus, medius, minimus. So sometimes the naming of the muscles gives you some information about the muscle. So let's get started on the actual muscles. So we're going to start with the facial expression. Now, I don't have my little assistant coming in today, so I didn't even try with that one because I figured the joints was going to be the easiest for him. So these here are old textbook images. I tried to put circles on them. So if you're following a textbook or you have another resource, textbooks are really good because they show you really nice drawings, and pictures are often way better than cadaver pictures because they kind of give you a better 3-dimensional sense. It's really hard. That's the hardest part about taking cadaver pictures. But notice here, I've got a bunch of them circled. But there's also a bunch that are not circled. So just know when you go, if you find some images that you're looking at, whether it's in a book or online, just go through the list that we have here and then just circle the ones you need to know. That way you're not overwhelmed by a giant list. Because I did, although it doesn't seem like it, the list is pretty big that you have to know, I did try to exclude as many as I thought I could. I really tried to default to main muscles doing jobs in our body that's going to be more common that you're going to need to know, and muscles that are superficial that you can palpate and touch and use as a body reference for. So let's get started. So muscles of facial expression. So occipito actually goes from the back of your head over the top of your head, occipitofrontalis, going to the frontal bone. It lifts your forehead up, unless you have like somebody with Botox and they have them all in there, but it lifts your forehead up, your eyebrows lift up really high, and that is giving you our surprised expression. So that's one of our occipitofrontalis. Then we have orbicularis. It's a circular muscle, so because it's orbiting. Orbicularis oculi, that tells us it's going around the eye. So that one would be like our winking muscle. Then we have orbicularis oris. So it goes around our mouth, right there. So that's our pucker up muscle. Then we have buccinator. I had a really hard time finding a picture for this one. I don't know. So this one, she's actually kind of biting her teeth, her cheeks. But buccinator is lining the inside of our cheeks. So it helps hold in and hollow out our cheeks. Then we have zygomaticus. So I forget, Jennifer Gardner, she always has a pretty smile. So that is actually connecting from your zygomatic bone to the corner here, and it's our smile muscle. There we go. And then depressor. So there's several labii muscles, but we're going to go depressor. That means we're just pulling it down our lip on the low side. So it's actually down here, it's pulling your lip down. So that's our pout muscle, depressor. We actually have a levator labii, meaning it lifts up our lip, but I just tried to put one of these. That way, if you see names for some of these others, if you're doing something specific to the face, and you have to learn additional muscles, at least you have one point of reference. And then there's, again, other labii muscles. This is just the only one I've picked for you to know for our facial expression ones. So this is from our lab guide that you have posted on Canvas. This just shows the list. So we've got them all there. I kind of try to say occipitofrontalis, that's our surprise look. You know, so the action would be elevate eyebrows because the muscle's there on your forehead and lifting up. So I tried to include you know, something in italics that would help you know them. So you should know the name of the muscle, where it's located, and its action. So now muscles of mastication, that's eating. So the masseter muscle is right here on the side of the jaw. And so you sometimes, if someone, especially men, if you, not that they get angry more, I'm talking about someone gets really angry, but men tend to have more prominent masseter muscles, but we all have the same muscle. And so it's across the ramus of our mandible. And if you were to clench your teeth down really, really tightly, and sometimes you can kind of see someone's jaw tense on this sort of posterior part, kind of just anterior to the angle, but right across the ramus, that is the masseter muscle. It's our main muscle for clamping down. So in its actual action is elevation of the jaw, because it's bringing the jaw up to the skull. So it has incredible force. Then the temporalis muscle, it actually is over here, over the temporal bone, and it attaches onto the mandible. So it also facilitates chewing. So if you're chewing gum or you just want to do fake chewing, you can feel on the side of your head and clench your teeth, you can feel your temporalis muscle also. So in this case, because the masseter is the strongest and it's the main one that's going to close your jaw, or in the proper terminology, elevation of the mandible, the masseter in this case would be the agonist, which is also known as the prime mover, where the temporalis would be a synergist, and then it's a helper. So you have one that's the main guy working, and then another one that's going to be an assistant. Now we'll move down to the neck. So the muscles of the neck are the three that we'll go through. There's lots of them, but we're just picking these three as the highlights. There is the platysma. So I'm going to do an on-screen share and show you an unflattering view of me so I can show you my platysma. Then there is another muscle. This one's the longest spelled out one. Sternocleidomastoid. This one tells you exactly where it's at. It attaches to the, well, they only have sternum, so it's going to actually attach the sternum here, sternum and the clavicle, and it's going to the mastoid process. So it actually makes, it's like a triangle. So we see that over here. Here's one attachment site, here's the other, and then the other is back over here on the mastoid process. And then scalenes, there, if you dig down even further, that's why I had to have this other picture, they're underneath the platysma and the sternocleidomastoid, and they're just connected to the top part of the ribs. They're actually involved in taking a really, really deep breath, and so it's attaching from within. So they're quite deep. So I'm going to do a quick stop share. So the sternocleidomastoid is one that often, if they're both sides are working together, it's going to cause the flexion at the neck, bending your head forward because it's pulling down. It's grabbing from the mastoid process and anchoring down to the sternum and then the clavicle, pulling your head down. But you can contract one at a time. So one side can contract and actually turn your head. So if my right side's contracting, it's pulling it in and it will turn my head in that direction. So, or both can contract together. So it also involves in rotation of the head as well. We can, some people, I don't know, forget what I have to do to make you see it. A lot of times I notice on people, especially women, I'll see their neck is more prominent. Especially if they're more slender, their neck, they'll make a motion, you can see that muscle sticking out quite prominently. Then there's the platysma. So I'm going to show you, it's like kind of ridiculous. It's a really thin muscle. It's right under the skin of your neck, and it really comes and attaches to the outside of your mouth. And so I always like to say, when you name the platysma, you can do its action. So I'm going to do this. So if you go platysma, you can see my neck all flaring out like a goof. So, and so it's just pulling my neck, like draw down like that. So it's quite ridiculous looking, but that's your platysma muscle. So we'll go back to the PowerPoint. Okay, here we go. So on your lab guide, this is what we got. You should know masseter. Oops, I thought it went back. Sorry. Breathing. My pen Masseter, temporalis, those are our eating muscles. Oh, I forgot to tell you that temporalis can also, for those of you that can wiggle your ears, I can't, but it must be some sort of genetic thing because my father could and my daughter can't. But if you can do this funky thing where you can sort of somehow activate the temporalis muscle, maybe they're clenching their jaw, I don't know, but you can kind of, the ears are located just underneath the temporalis, so it actually can cause your ears to wiggle a little bit. So I just only put that because it was helping you identify its location. So it wasn't so much like wiggling the ears is its action, it was just helping you understand its position. And then we have muscles of the neck, platysma, sternocleidomastoid. I think scalenes must be on the next list because although it's in the neck, it's part of breathing, and that's our next part here. Yep, there it is, scalenes. So we go into breathing again, and these muscles specifically in 202 when we cover the respiratory system. But for our purposes in this class, inspiration is breathing in. When you breathe air in, it happens opposite to what people assume. Your diaphragm, which is obviously the membrane, it's a muscular membrane between your thoracic cavity and your abdominal cavity. So your diaphragm actually drops down. It's a lot like, so in its relaxed state, it's up like a dome. And when you want to take a breath in, your muscles will contract it and it pulls it down and flat. So your thoracic cavity gets bigger. It's like the floor of your lungs drop down. But because your lungs are stuck to the floor, it expands and pulls the lungs open. So you end up with a larger space. Because you have a larger space, you essentially create a vacuum and air gets sucked in. We always think of breathing in as, oh, all of this air came in my chest and my chest expanded. No, you use your external intercostals. Intercostal means between the ribs, but we have external ones. Notice we have internals over here, but we're not dealing with those yet. The ones on the outside pick your ribs up and out. Those are the external intercostals, and they actually help make your chest wall bigger. The diaphragm drops down, help make your thoracic cavity bigger. The scalenes are going to help lift up your uppermost ribs. That's going to help all of these here breathe air in, help you breathe in because it's helping to enlarge your thoracic cavity. When you breathe out, you basically let go of the diaphragm, so it just springs back up and pushes air out. But if you really want to breathe out more forcefully, like say you're blowing out a bunch of birthday candles, then those are your internal intercostals, and they're pulling your ribs back down and in. So I should have a picture here. So our external intercostals are these guys out here, noticing they're angling from medial out to lateral. So when they lift, I'm looking around here for a bucket. My normal demonstration for this is literally a bucket. So you're gonna have to imagine a bucket with a handle. So when the handle is laying against the bucket, it's pointed down. Ribs are higher in the back than they are in the front. So they angle downward and forward. So that would be like a bucket with the hinge, with the handle part down lower. When you lift the bucket handle up, notice that it comes, instead of being flush, it comes up and away from the side of the bucket. That means when our external intercostals are lifting all of our ribs up, it's moving them actually up and away from our torso, which makes it bigger. Whereas the internals, which is kind of here, those go in the opposite direction, so it actually pulls those ribs back down together. So our ribs really pivot from their attachment back on the thoracic side. You can kind of see the movement here as far as the ribs, especially how they angle downward from the back, and then when they're lifted up when we want to breathe in. So as far as respiration, what we breathe in, these are the muscles that you want to be concerned with. Breathing out is expiration. Notice on the breathing out, I did not say diaphragm, even though that's the main way we breathe out. When the diaphragm contracts, it drops the floor out. How we breathe out is that diaphragm just goes back up into position. But we never name a muscle for what it does when it relaxes. So when you name a muscle and its action, it's when that muscle contracts. So specifically for the diaphragm, When it contracts, it goes down and it enlarges the thoracic cavity. So that's why it's involved in inspiration. Conceptually, it does push the air out when it goes back up to normal, but because it's doing that on its relaxation, it's not named for expiration. Okay, so here's some muscles of the trunk, the abdominals. Tried to find some good abs here, six-pack abs to show you. Those guys here, this is your rectus abdominis. So again, the word rectus means straight. And actually how the muscles go is the muscle fibers are straight up and down. They just happen to be in these little patches. So that's why it's named. They're straight fibers. They're going up and down. They are located within a tendon sheath, and they're in these smaller sections. Let me check out another question. Okay. So then, I think I may erase this. Erasing is, okay. Then we have, okay, so we'll go through the obliques. The obliques here, all of these, notice they say, oh, not the bottom one, external and internal obliques. They go at an angle. They're either going to go this way or they're going to go this way. I like to think of them as either like a V or an A. So we'll go to the next slide so you can see the pictures a little bit easier. There we go. So we have our rectus abdominis here in the front, more center. But then just outside of it is our external oblique, and those will be like a V, but it actually doesn't go there. It actually goes here, and they are attaching to the same tendon strip that our rectus abdominis does, but the muscle fibers are just located more to the sides of our torso. But they're on the outside, they're more superficial. So if you're dissecting somebody, you go, peel the skin off, and then you'll see the external oblique muscles on the same layer as our rectus abdominis. If you peel the muscle back farther, so you're a little bit deeper, now we get into the internal oblique. They go from our iliac crest up this way. So I like to think of them as shaped like the A, where it starts wide, they come out narrow or come up towards the midline. So these ones I think of as a V in terms of their muscle fiber direction, where the internal obliques, their muscle fiber direction is that way. Transversus abdominis, it's going to basically circle the waist, even though it doesn't go to the back. So the transversus is more if you're going to suck your guts in because you're trying to hold your belly in to be a skinny, like if you had a belt around it. So that is the direction of the fibers, straight around that way. That's the transversus abdominis. So we'll go back here. So the muscles of the trunk on the anterior side, what is its main job? These all do flexion, let me get this pen, flexion of the torso. If it's oblique, because it could be one side, can also do rotation. When we say flexion of the torso, it's like the motion of a sit-up. If you're standing up, and I forgot when I was doing movements the other day, I could have used my little guy instead of me trying to do some weird yoga moves. So, well, his body. But if you were going from this motion here, and his upper body was to bend forward, like he's leaning forward in a bow, that motion is flexion. So obviously rectus abdominis is down the front and center. So it's, he's able to bend forward. Oh, I guess he does bend, yay. So this would be flexion of the torso, and then go straight back up. Rotation, oh yeah, he can kind of rotate, or rotate this way. Again, those would be the obliques, and there goes his arm. And then transversus abdominis is if it goes around and it's just squeezing, like you're trying to suck your belly in and have a tiny waist. That would be the role for that. So then we go to the opposite side. If we go to the back, on the back, we have lots of muscles, but the ones that we're really going to focus on is erector, that means lift up, along the spine. So the erector spinae muscles, you can see, let me move this here. They are a whole family of them back here. So, and they all have individual names. So I'm just naming it for this large group. But see here, erector spinae, they're starting really low, attaching onto the sacrum as well as your lower lumbar. Then that gives it a really good anchor point way down here so that when they attach, you've got them attaching at different levels of the ribs all the way up the entire posterior side so that it will cause you to extend the torso and lift up. So it does the opposite. So if we go to our example, if I were to give you a motion, and if I were to say the motion is flexion of the torso. Flexion of the torso, that's bending forward. I'm going to put my little skeleton guy back so I can, right? Flexion of the torso. That if we have the agonist, also known as the prime mover. In this case, it would be rectus abdominis. And then the antagonist would actually be your erector spinae muscles because it does the opposite. If we were going to name a synergist, we could say something like our external and our internal obliques together. So they're helping flexion of the torso. So this is kind of another, I try to, when we do a motion, try to have a muscle on either side. Just a little tip for people that are runners. Running does a lot of, obviously running, you're using your legs a lot, but running will also build up your muscles on your back. And a lot of times if runners don't do sit-ups and actually strengthen their abdominal muscles, they tend to arch and curve at their lower back. And so sometimes the runners I know are pretty obsessive. They're just into running and, you know, they're not really, some of them don't care about like, you know, working out and overall balance. I'm not saying for that a bad thing. Some people are more focused on balance for looks or physique or whatever, but some runners don't think about it, excuse me, and they just run. But then they get back pain and they get leg pain, they knee pain, and it kind of compounds from there. And a lot of that can be alleviated by just doing a regular battery of sit-ups when they run. You want to make sure both sides of any joint, and even though our waist and our torso, we don't think of it as a joint, but it's a movement, that they're both balanced, because running actually builds up your back muscles or lower back quite a bit. So just as a little tip there for you runners out there. So if we're talking about the muscle of the torso, I only have one on the posterior side, and then I have these abdominals on the anterior side. Now notice if we're doing muscles of the torso, look at what a doorknob I am. I put a skeletal system there. Well, I actually did it on purpose, so I wasn't just being a doorknob in this case. I put those there because I wanted you to draw your own muscles. So if you're doing, you know, rectus abdominis, you can sort of draw them coming down. You could do your external, internal obliques, whether you're doing your V's or you're going to, you know, go do the A motion. So they're really, the bones there are meant for you to actually draw the muscles onto them. So we'll go through our appendicular muscles. I was trying to find muscles here. So when you do the workout, the sort of the bodybuilder folks, they are quite enlarged as far as their muscles. So you can see a lot of these superficial muscles quite prominently, especially because they have such little body fat and they're really lean. For the female here, it's really unusual to have legs that lean and to see the muscles that prominently. So that one's a really nice example. Okay, so we'll move forward. So sometimes actually in class I had, it's really old now, so I haven't bought one for ages, a muscle, was it Muscle and Fitness or something magazine, where we were trying to name muscles anterior and posteriorly. So it's kind of a one way to practice looking at muscles. but we'll stick to these cartoons here for now. The pectoralis major is the main muscle across the chest here. So let's see if this guy, that's his pectoralis major. Remember, it's an example of one of our, let me erase all this because that was kind of a bad drawing. One of our convergent muscles. See how it actually starts from the sternum and then it actually inserts over onto the arm. And so a way to strengthen that muscle, because it does flexion the arm. But again, it's hard to say flexion of the arm because we're thinking flexion of the arm is lifting it up and forward. This is bringing it, if your arm is out to the side and it's bringing it in anteriorly towards the midline. So that's why, say, a bench press would be something that would help this here. So that's the pectoralis major, because it also, adduction, it also brings your arm in from the side. And because it's attached to the front of the humerus, it causes medial rotation, helps you rotate your humerus inward. So this one has kind of a fair amount, a lot of motions embedded in one. And each of these different motions are actually using kind of different muscle groups in here, which is why if you're doing push-ups, and with the part of the push-up where you're extending straight up is really engaging the pectoralis major, whether your arms are really wide or your position of your arms helps you focus on different parts of the pectoralis major as you're working it out. Pectoralis minor is also in your chest, but it's just smaller. So pectoralis minor is over here and it's attached to a few ribs. It's attached, up here to the scapula. And so it's not very robust at all, but it's downward rotation of the scapula. It helps to kind of pull your rotate it forward. But notice I put in the word stabilization, because when it contracts, it's not really doing a lot of movement. It's just grabbing onto the scapula. It's not like the pectoralis major grabbing onto the arm and your arms are moving, whether you're doing push-ups or bench presses. Pectoralis minor is really, when it contracts, it grabs onto that scapula and holds it still. Because some of, let me see. So one of my favorite drawings is the classic man from that Leonardo da Vinci drew, where it's like the man standing up to the side, there's a big circle around him. That used to be in the gym when I was at the University of Oregon, and I did exercise science as part of my undergrad there. And when we were doing the muscles, then we had to do like workout sessions with the muscles. In one of our biomechanics classes, they had that, and it was talking about the origin and insertions and the trunk muscles, and the stability of the trunk is often, the strength there is more effective in your limb movement and propulsion. So say you're going to throw a javelin or a shot put, they're heavy and you're moving your arm a lot. And so you think, oh, maybe I should work out my arms a lot more. You can throw the javelin farther and the shot put harder if your core is stronger and your base is solid, and then the limb muscles can go. So although the biceps and the pectoralis majors, they get a lot more play and a lot more attention, some of these smaller muscles that we list as stabilizing muscles, I mean, they're just holding that scapula still. That's because you want a good solid anchor so that when your arm is actually in motion, you have a solid anchor point for it to start from. So it's sort of like if you're going to take off running and you're on a slippery surface. No matter how strong your quads are, if your foot's not anchored, tightly to the surface and it slips, you're really not able to utilize the muscle of the limb. So you want to have a strong anchor point. So the stabilization isn't some sort of brush off. It actually is an important component. So the serratus anterior is also more of a stabilizer because it comes around. Let me see, is it over here? Sorry, this video list. It's over there on the side, but let me see if there's a better picture. I don't have a better picture of it. I have this, so where it's located, the serratus anterior has these little individual finger-like projections. They sort of land on a number of ribs, but they attach to that inferior angle of the scapula. So when it contracts, it actually is holding the scapula in place, and it allows the other muscles of your arm to move the arm. So again, stabilization is its most important job. Okay, so we'll move forward. This is a picture of the post pectoralis major. I want you to notice here where it's attached to the humerus. Now we really can't see on the bony part where it's attached, but if you hold your arm straight out to the side and you were to, let me take off my coat jacket here, if you were to hold your arm straight out to the side, it is the front of your armpit. So if you're sitting there pinching and your thumb's in your armpit, and that's probably a really gross depiction, that is your pectoralis major. We're going to talk about our latissimus dorsi in the back, and it actually is the back of your armpit. So I'm going to spare you and not show you my armpit, but if you were to go to the side and actually see your armpit in the mirror, the reason why it makes a pit is you have the pectoralis major crossing over to your arm in the front, and you have your latissimus dorsi crossing over on the back. Let me put this back on so I don't sit here lopsided. Okay. All right. So there's that. Oh, good. Here's serratus anterior. So you can see just the side here where it's attached to your ribs. We see the pectoralis major and pectoralis minor. If we peel the muscle further back, again, pectoralis minor and major are really adhering to that scapula, so it helps hold it in place and provides it as a good anchor. So the muscles of the trunk anterior, you should mainly know pectoralis minor, because it's muscles of the pectoral girdle. So these guys are more about stabilizing. So yeah, they have other, kind of actions. The serratus anterior, I told you that it attaches down to near this inferior angle. So you think, oh my goodness, why is it upward rotation? Well, I happen to have a scapula right here. So if you are hanging on here and you're anchoring it, notice where you anchor, how the top has a lot more play and movement. So just because it's attaching at the bottom allows for it to move in the opposite way. So that's why sometimes things seem backwards. You might think it's a typo. Well, sometimes it's a typo if it's me, but in this case it's not. So it's stabilization of the scapula, but if we're doing serratus anterior, upward rotation. It actually, in this case, I was rotating it the wrong way here for you guys. So if you have serratus anterior hanging on, notice it's coming to the bottom and it's coming around. I wish I had my, oh, maybe I could do it on this little skeleton guy. Okay, put him here. Oops, here's our scapula. We'll put it on. Sorry, I'm looking at the screen and here, and then it goes backward. So if it's this way, obviously, and we have the bottom of the scapula attached here, if this goes forward, so if the bottom here moves forward, you can see up here will go up. So let me do the motion for you here. If we have it here and the bottom moves forward, look at where the glenoid fossa is pointing. So if it sits like this and we pull it, we're actually using the bottom to pull forward, it lifts the cavity up. That might have not been very helpful, sorry. The main job, let me erase all this here. So it does have slight of these motions here, but the main job again is stabilization just because it anchors onto there. The main ones that are going to move the whole arm, because it's got a lot more mass, is going to be our pectoralis major. And so that's actually coming across from a wider base and again forming the anterior part of our armpit. So then muscles of the trunk on the posterior side, so we're doing the back side, these are all the biggies. So we have our latissimus dorsi, which is not in this picture. Teres major. Now we talked about teres minor earlier when we did the rotator cuff muscles, and we'll bring that one up again. But these ones are main muscles of the trunk that are actually doing a lot more movement of our limbs. So I'm tired of the red color, so I'm just going to switch over to a blue color. So because latissimus dorsi is not in this particular picture, we're going to start with teres major. Teres major is right here. Actually is right under teres minor, but because teres major goes and actually attaches to the diaphysis, meaning the shaft of the humerus, it actually has a lot more action in arm adduction, bringing the arm back down towards the midline. But it's a small muscle, not like latissimus dorsi, which actually attaches over here, but it takes up most of the large back. That would be a prime mover or a main agonist of bringing your arm down. Right here. Okay, trapezius, they're showing just one side, but it goes across. So it's going up the neck, it comes out, and it goes along the spine of the scapula, and then down, and then all along the spinous processes on the back. So that one has, because of its wide range, it does a lot of different things. So I'll just sort of, I try to pick the underlined ones, or just sort of like the main ones that maybe you want to stick to. That way you're not trying to memorize so many things. So the trapezius will shrug. So it's going to actually lift your shoulders up or elevate the shoulder. So shrug is kind of a bad term. That's not a very good anatomical term. So let's say elevation of the shoulders. Because it's also does retraction, because it actually can pull this way as well. That's its retraction. And because it lifts up here, it also can kind of rotate your arm forward. But let's make life a little bit easier and stick with one main thing that it does, and it's going to cause elevation of the shoulders. And in fact, a lot of those football players that look like they have, or other type of strength people that look like they have no necks because they're so giant, is they're trapezius, and they actually do it. They're overdeveloping the upper part of their trapezius, and that's where they get the no neck look, because they're doing a lot of shoulder shrugs with weight. Levator scapulae. Now this one, people always get backwards. This is levator scapulae here. So it's underneath the trapezius. They've peeled the trapezius away so we can look at it here. And notice that it's attached, this top part of the scapula, and it's attached to some of these transverse processes of the cervical vertebrae. So again, I don't want you to, you don't need to recount its origin and insertion, but I do want you to look at those things, because notice it says downward rotation, and people think, well, that's got to be a typo. The name of it is levator. Levator means like an elevator. Well, it does elevate this side, but like a teeter-totter, that means this side is going to go down. So that's why you have the downward rotation. So even though the muscle action here lifts this part, it's actually dropping the cup. The glenoid fossa is actually going to face down a little bit more, and your shoulder will drop down. And in fact, this is the muscle. If you are sitting at a, let me stop share for a moment. So if you're sitting at a desk and your arm is out and you have your mouse and you're moving your mouse, because the motion with your hand on the desk, with your hand on the mouse, you're pulling the mouse back. You're not doing these giant motions, obviously. The mouse only moves like forward and back just slightly. So you're gonna pick your body picks a smaller muscle to recruit. And it's almost always this muscle. So if you're working for a long time at your desk and you're using a lot of mouse work, so to speak, and then later your shoulders just feel like you need a back rub really bad, it is usually this specific levator scapulae, because it's doing these subtle forward and backward movements. So, and it's like you going back is dropping your shoulder down. And again, that's a levator scapulae action. Okay. Then we have our rhomboids. So we're sort of going to call them as one rhomboid family. Technically, there's two of them right side by side together, rhomboid major and rhomboid minor. Those guys are right here, this here. So they're attached to the medial border of the scapula, as well as the spinous process. So this here is rhomboid major, and then I'll just put in solid. This one's rhomboid minor. A lot of diagrams don't, this one happens to show the line between them, but a lot of diagrams don't. And so sometimes rhomboids are just sort of said in plural and not always utilizing the major and minor component. Now it retracts the scapula, meaning on both sides, it takes the medial border of the scapula and it pulls it towards your shoulders. So if you have like a rowing machine, let me sit up a little bit more, and you're going to do the pull and you bring your shoulders way back and you're bringing your shoulder blades together behind you, that's retraction of the scapula. When the two scapula are coming closer with your arms going back towards your vertebral column. So there's that. So that's what retraction of the scapula means. It's bringing it in towards the midline, and that's the rhomboids are pulling it in that way. Okay, oh, here is our nice picture here of our latissimus dorsi. So it was on the previous list, I just didn't have a picture of it. So you can see it's huge anchor based also along the sacrum as well as your ossa coxa, the ilium specifically. So it has, this is our strongest back muscle. It's a major convergent muscle. So see how it goes up, and it really has a small insertion point compared to its origin base. So if your arm is straight out to the side, this is the back of your armpit right here, which is your latissimus dorsi muscle. Now teres major is tucked in right there next to it, but the bulk of what you're feeling underneath your armpit, with your arm straight out, that's your latissimus dorsi muscle. People shorten it and call it your lats. And because you have this huge base here and a single point, this is also known as a swimmer's muscle. If your arms are straight up over the top of your head and you're just pulling them straight down to the side, like you're all of a sudden taking a big swing underwater and just shooting yourself forward, that builds up your latissimus dorsi muscles. In the gym, there's a thing called the lat pull, and you go pull from above your head and you pull down. And when you pull down, you should pull down often kind of behind your head, but depends on the different forms that you have and who's teaching you.
I think the straight arm pull down, not the actual, like when you go, it works the serratus like the swimmer's muscle.
Okay, so the latissimus dorsi is known as also, or I've understood to be known as the swimmer's muscle because it has a larger mass and it is pulling. It has the greatest contribution to moving the arm and adducting the arm down. So it's going to always be the prime mover.
You kind of go like straight, elbows locked, and then you pull.
Okay, that would just.
I've known that.
Okay, so if you move your arm more forward, then you're also, and moving or pulling back, you're also utilizing more of your rhomboids as well as some of the other scapula associated ones. So these pictures here are again coming from that radiology at the University of Washington up there in Seattle. And they have really nice pictures where it just isolates these muscles. So you can see the levator scapulae, you can see the rhomboids, and teres major. So I'm going to take this opportunity. I think the rotator cuffs are next, but teres minor is right up here. Remember all the rotator cuff muscles, they are all going to attach around the head of the humerus. And because the rotator cuff muscles that we're doing, I think hopefully it's next, they really just hold that head right there in the socket. So they're primary for stabilization. So teres major is not in that group because see how it's attached more to the shaft of which is the diaphysis of the humerus. So it actually has more of a significant contribution in moving your arm, where later the rotator cuff muscles don't really move your arm very far because they're attaching so close to right up here. So just wanted to point out that distinction. So another one of these, the trapezius, we see teres major at this point and latissimus dorsi. We peel back, we see serratus anterior attached here to this inferior angle moving forward. We have teres major. This is teres minor. Remember we have supraspinatus, infraspinatus there, and then the ones that we've already talked about are the rhomboids, which shows you the minor as well as the major. So muscles of the trunk, the posterior side, we're going to, ones that are attaching to the pec position, they're positioning the pectoral girdle. So we have, and again, you can do your trapezius where it attaches there as well as to the spinous process. So you can sort of draw that there where we know levator scapulae is going to be what's attaching to this part of the scapula. So when it lifts this part up, this part will go down. That's why it has the downward rotation. So people always assume it's backwards because of the name. Rhomboids are going to bring it back towards the midline, bring your shoulder blades back. Those ones, and so they're right there within just moving the pectoral muscle and kind of moving your shoulders around. But if we're going to do a lot more movement of the arm, we're going to have a lot more leverage. So we're going to want to probably draw a humerus, and we'll have teres major there, as well as latissimus dorsi. I'm drawing some really bad fibers there, but you can see their attachment is going to be more on the on the arm itself. So we'll go through the rotator cuff muscles, and then I think that might be, we'll see, that might be the end of what we'll do today. So this is kind of a recap what we have. Supraspinatus and infraspinatus. So again, we did this just the other day. So we move this here. Supraspinatus, because if this is the spine, let me change back to red. Supra, meaning above the spine, is going to be here. And then infraspinatus here, and attaching over here. And then teres minor, sorry, that's teres major. And notice these three are all attaching to right behind the head, like of the humerus on the back side of it, on the lateral side. So all these three are going to be on this posterior side. So we have this one, supra at the top, we have infra here under the spine, and we have teres minor. Subscapularis is just going to be on the other side, which apparently I don't have a picture of. There you go. You can see subscapularis over here. So this is the only one, notice the sternum. So this is the only one that's an anterior view, and it's the whole underside of the scapula, and it's attaching here. So it's the only one that you can see from this perspective. So those are the rotator cuff muscles. Again, we can see them listed here, teres major. I put that one in sort of a grayed out because since we're talking about the rotator cuff muscles, I wanted you to see these ones, supraspinatus, infraspinatus, and teres minor. But because it's such a good picture of teres major, I wanted to let you know what it is. This is brachialis over here, but since we haven't talked about it yet, I didn't label it. So these three in the brighter white are rotator cuff muscles. We can actually see this rotated view slightly tipped forward. So we can see on the anterior side, the subscapularis, and you also see teres major just for reference sake on this. Okay, again, another view there unlabeled. So I saw this picture, I thought that was kind of handy. Again, you can draw them on the skeleton, and you can have this rotator cuff muscles. Here, this had just the other ones we talked about. I think we'll go a little bit more. So the muscles of the arm, since we're here up at the shoulder, we're going to go through the deltoid. The main job for the deltoid is arm abduction. That means pulling your arm away from your body. Now, because our deltoid has three sections, there is an anterior section, and there's a middle section, and then you can't see in this picture a posterior section. So if you're to pull your arm straight out to the side, you'd have kind of an anterior band. You have a band kind of towards the midline and then one towards the back. Because of those three sections, it does medial, that should be an L here, lateral rotation at the shoulder. So, and it depends on which section that you're actually recruiting. So let's just make life easier and say it's the main one to abduct the arm. And so its antagonist to bring the arm back down would be your latissimus dorsi as well as your pectoralis major muscle. And then we'll just end with that. So then that way when we come back, we can talk about the limbs. So we kind of gave you enough with the head and the front of the torso and the back of the torso. So then that way when we come back, we'll talk about movement of the limbs. We did a little movement of obviously of the upper limb, but we'll do like our triceps brachii and our biceps brachii, our forearms. We'll do our gluteal muscles, or muscles in our gluteal region, as well as our lower leg. And then that'll be it. And then we'll still be able to have a review the following lecture. So again, I'm going to give you a heads up. I'm going to, let me turn this off.